United Healthcare is my favorite company ever. I love them so much, and I am sure they have done nothing mysterious or legally dubious in their past. To confirm my blind corporate loyalty, we are going to examine their recent business performance and practices, starting with their MCR. United Healthcare had an MCR of 84.8 in the first quarter of 2024. What is an MCR? An MCR is the medical care ratio. It's how much of your revenue is spent on medical care alone. For the full year, it was 85.5%. They made $400 billion in revenue, and $342 billion of this went to care. That's around $2 billion per day being spent on medical care. In the first quarter of 2025, the operating cost ratio fell from 14.1% to 12.4%. This is the amount they're spending on administration, salaries, transportation, etc. It fell from 14 to 12%. And in the first quarter of 2025, their operating income, which is how much they take home before interest, taxes, and other minor adjustments, was $9.1 billion, off of the $9.1 billion they would have had before these adjustments. So since April alone, the market cap, which is the total value of all the shares of a company on the stock market, and the way it's calculated is weird, but you can think of it and treat it like net worth or GDP. It's a good measure of the general health of a person or nation or, here, a company, but it doesn't really tie into any specific thing and can be misleading out of context. Regardless, since April of 2025, the market cap has gone down $250 billion, which is a nearly 50% decrease in the value of their shares. In the first quarter of 2025, the amount they were spending on care rose faster than revenue, with a 2.3% year over year. A healthcare breach cost nearly $1 billion in disruption, and the New York Times reported that $9 billion were discovered in questionable Medicare billing in 2021 alone. Not only that, but there have been numerous reports of secret payments given to nursing homes to delay hospital transfers, moving seniors away from higher cost care. So it's a mixed bag. Some things are really good. They're spending more money on medical care, kinda. Some things are really bad. They're bribing nursing homes to delay hospital transfers, which is bad. So how much of the money they spend on care goes into direct care, right? So MCR includes direct care like hospitals, drugs, paying for doctors, and some care coordination like nurse hotlines, quality improvement activities, which is loosely defined as systematic, data-driven efforts to improve healthcare processes and outcomes. So that could mean basically anything at all as long as it touches a hospital at some point. It also includes in-house services like Optum Billing and AI tools and NHPredict, which technically means denying care is included in MCR. So not all MCR heals people, and a portion of it is a closed loop of internal profit and cost-cutting mechanisms. So MCR, as you may have guessed, does not apply to all revenue that United Health Group produces, right? Only the revenue from premiums specifically on fully insured health plans. It doesn't touch self-insured employer plans, which United Healthcare administers. Revenue from Optum, banking and finance, or government contracts outside of Medicare Advantage, which is about $200 billion, in no way, shape, or form affected by the MCR requirement. This begs another question: do they use this extra revenue for medical care? Short answer, no. Long answer, sometimes. If this revenue is run through an MCR regulated insurance product, or if it's contracted care, i.e., through Optum clinics or partners, then this non-premium income is used for medical care. For a total breakdown, United Health Group, which is the entire conglomerate, made $400 billion last year, right? $248.8 billion came from the United Healthcare, which is their insurance wing, and $151.9 billion came from Optum, their health services wing. They spent $212.5 billion on medical care and $30 billion on administrative and operating expenses. Optum spent $140 billion on the cost of their services and $11.9 billion on operating expenses. That makes the operating income of United Health Group $32.3 billion, with their net income to be $15.5 billion, with their total cash flow from operations being $24.2 billion, which correlates very well to their reported 7.4% operating margin. As for MCR specifically, we do not have the data as United Health keeps a tight ship and these numbers are very well guarded. However, we do have estimates from the Health Policy Analysis and watchdog groups such as the Kaiser Family Foundation and the National Association of Insurance Commissioners, who tell us that around 70% of their 85% MLR is spent on direct medical claims, which is the good stuff, and 10% is spent on coordination and that vague quality improvement we talked about earlier, with 5 to 8% being logistical costs like payments to Optum units, tech transfers, and utilization management stuff that happens inside the company. So for every dollar you are spending, only 70 cents of that actually goes to medical care, and a third of that dollar goes to coordination, and some of it just stays inside the company in an endless loop. Extrapolating this, we can say that out of the $248.4 billion that insurance company alone made last year, and out of the $400-ish billion they made in total, only $174 billion actually made it to genuine medical care, actual payments to hospitals, doctors, clinics, and prescriptions, out of the $248.4 billion in premiums, and just 43% of the overall $400 billion revenue. That was a lot, and it sounds pretty bad. But what if it's not their fault? What if my beloved healthcare conglomerate is being brutally oppressed by some despicable ne'er-do-wells? Well, United Health Group is American, meaning they are accountable to the United States government. Specifically for them, the Centers of Medicare and Medicare Services, state insurance commissioners, the Department of Justice, the Federal Trade Commission, the Securities and Exchange Commission, the Office for Civil Rights, and the Department of Labor. They are also a company which makes them accountable to shareholders and the stock market, primarily Vanguard with a 10% share, BlackRock with a 9% share split between BlackRock and BlackRock Fund Advisors, State Street with a 5% share, and Fidelity with a 3% share. Overall, 90% of United Healthcare shares are owned by big money institutional investors, making their decision-making apparatus almost entirely corporate-minded. Companies of all kinds are also accountable to clients. Here, those are large employers and federal and state governments. The thing is, government contracts are huge and hard to cancel, and employers often neglect to dig into plan design or patient outcomes. As a healthcare insurer, United Health Group is accountable to about 50 million Americans who are patients and consumers under them. However, because most cannot switch providers, and the appeals process is intentionally designed to be basically useless, outside of organized violence and class action lawsuits, there is no direct line of accountability between consumer and producer. Finally, as a public entity, United Healthcare is accountable to whistleblowers, media, and class action lawsuits. United Health also administers self-insured employer plans, which is a huge chunk of their business, but under ERISA rules, those who are self-insured are not subject, as we stated previously, to the MCR requirements. Unlike most companies, United Healthcare is vertically integrated through Optum, meaning they control the delivery, data, and financing of care, much like the Rockefellers or Vanderbilt Steel. However, unlike them, there does not seem to be much of an emphasis on delivering a quality product. A survey by Representative Pat Ryan in the Hudson Valley found that 41% of respondents had worse care since the Optum takeover and United Health Group, and 49% had difficulty even getting appointments. Staff who worked for United Health said that they were overworked and did not maintain adequate care. Mothers waiting almost a year for a cancer diagnosis and pharmacies messing up prescriptions, often due to chronic worker burnout. United Healthcare themselves report that 80% of their Medicare Advantage enrollees are in 4 or 5-star plans, while J.D. Power ranks United Healthcare the top in certain states and middle in others as far as quality of care, which muddies the waters exceptionally. To get even muddier, when the Wall Street Journal revealed that insurers, including United Healthcare, code diagnoses like HIV without proper or sometimes any follow-up, which has inflated Medicare Advantage payments by up to $50 billion over the past 3 years. But to totally obliterate any sense of consistency, United Healthcare brags openly about their 2.5 million home visits, 300,000 seniors identified with emergent needs, and a 75% follow-up rate post-discharge. So, what explains the 69% of Americans who are entirely dissatisfied with healthcare quality? How can we synchronize this seemingly conflicting data? First off, how do you even measure stars? What does a 4 or 5 star even mean? United Healthcare brags that 79% of their Medicare Advantage enrollees are in 4 to 5 star plans, but these ratings focus on process measures like screening rates, adherence to medication, and paperwork completion. It has nothing to do with patient outcomes or experience. They rely on self-reported data from themselves and claims coding that insurers submit themselves, which gives us really bad methodology and a huge conflict of interest in the star measurement. A 2023 report from the Medicare Payment Advisory Commission pointed out that star ratings do not correlate in any meaningful way with patient satisfaction or health outcomes. In 2024, a Kaiser Family Foundation poll showed that 69% of Americans are dissatisfied with healthcare quality, stemming from long wait times, difficulties getting appointments, and poor communication and rushed visits, all of which are common symptoms of extremely poor employee management, which we will get into later after I tell you about the upcoding thing I referenced earlier. Upcoding is when you inflate diagnoses and make them seem worse than they really are, and in response you charge more for care without actually delivering extra care. The Wall Street Journal 2024 expose estimated that this could have cost the taxpayers $50 billion over a 3-year time period. This display inflates metrics like the already unreliable star rating, which is one of the ways they're able to have world-class service on paper and still have terrible service. United Health Group also enroll healthier seniors in Medicare Advantage while avoiding or structuring plans around keeping complex, sicker patients out of, or at least ensuring they don't stay long. A completely legal practice known as risk selection, which improves average outcomes and star ratings, but leaves most complex or expensive patients to traditional Medicare or less effective plans. According to Health Affairs 2023, this practice skews performance metrics, making Medicare Advantage plans look better than they actually are. Another way United Health Group can make these claims is by highlighting internal metrics, like the 2.5 million home visits, which sound great, but now that we know that these visits have been reported to have been rushed and left people feeling dissatisfied from the Hudson survey, we can see the full picture, which is that these 2.5 million visits were rushed initiatives to check boxes and not actual examples of genuine medical care. So, why is the care quality of United Health so bad, or at least so poorly received? Firstly, their ethos is focused entirely on cost containment. They try to keep their overhead as low as possible, which is generally a really good idea, until you realize it means doctors have more patients they need to divide time, effort, and care between. They use AI to deny coverage, which often results in erroneous denials. Their vertical integration with Optum allows United Health to control the payment and provider side of healthcare, which has improved coordination, but also limits competition severely, which reduces quality directly and creates an incentive to ration care, since cutting a provider's costs benefits the same parent company. Additionally, 1,000 Optum-owned healthcare staff unionized, citing specifically overburdened work schedules and chronic worker burnout, and this was March of 2025, very recent. Pat Ryan's survey showed that staff in the Hudson Valley were also burned out and overworked, and that they were, quote, overworked, undervalued, and forced to compromise patient care. In May of 2025, an internal Optum staff survey from the Tri-State Medical Group revealed that a full 54% of staff openly reported burnout. Favorability, psychological safety, and intent to stay fell dramatically, with some scores dropping by 11 points. Major reasons for this were insufficient time for administrative work, bad tech support, and an excessive workload. Even without all these issues, United Health Group's real customers aren't patients, but, as stated previously, large employers and the government who buy wide-reaching insurance plans, which means that the non-violent or litigious means of holding companies accountable are not available to the people directly affected by any mess-ups, as they cannot switch plans and have very limited appeal power due to a complex or burdensome grievance system. Because of how Medicare Advantage operates, insurers get a flat fee per patient based on how sick they are on paper. That means insurers have a direct incentive to upcode patients and avoid genuinely severely ill patients who need long-term care. So, in a word, the reason that care is so bad in United Health Group is apathy. United Healthcare has no incentive to care about the consumer or the people they affect, because the only entity that can hold them accountable, the federal government, relies so heavily on United Health Group to administer Medicare Advantage that regulatory independence is not an option anymore. This structure leads to what researchers call administrative moral hazard. This is when public administrators, shielded from the full consequences of their actions, may take on excessive risk or act less responsibly than they would otherwise. So, can we reach a moral conclusion on the practices of United Health Group? Yes. It's bad. The end. God loves you, and so do I. Go away.